Hello everyone, welcome to Nurses, welcome to our channel, welcome to a brand new episode, a brand new video, and a brand new concept because today is going to be the beginning of our series called Board Exam Essentials. This Board Exam Essentials is basically very important for those or to those aspiring nurses because they will be facing the nurse licensure examinations few weeks or a few months from now. And of course, the examination is going to be set twice a year here in the Philippines. So therefore, it is but right also for us to have this vlog because this could possibly in any way could help, especially for those who wants to pass the board examination. And of course, since this is the beginning of our series, our topic today is going to revolve about consent. So this consent is basically very essential because these are also very common in the board examinations, especially in all sets of the examinations. We have nursing practice 1, number 2, 3, 4, and 5. So this might actually be asked in all sets of the examination. And also, it is very important for us to remember that we have to know the elements of the consent, the parameters of the consent, who can sign the consent. So that is the core concept of this specific topic. But before that, please allow me to share with you 5 most common questions in the board examinations that talks about consent. The first question is, what bioethical principle is being applied in securing the consent from our patient? So it talks about bioethical principle. The second question is, who is responsible in securing the consent from our patient? The third question is, what is the role of the nurse in securing the consent from our patient? The fourth question is, who can sign the consent in behalf of the patient if that is in state of emergency? The fifth question is, who is responsible in explaining the procedure to our patient? So these questions will be answered as we go along with our vlog, and of course you have to pay attention in these specific questions because of course that might actually be asked again in your examination. So let's proceed. Let's define first what is a consent. Consent is actually a document wherein a patient is going to allow a physician or a surgeon to touch his or her body, especially because if that involves any invasive procedure. Just remember also that consent is done especially if that is an invasive procedure. We say invasive, it means it involves cutting, it involves penetration to your skin, and anything that is invasive that involves high risk of possible infection or high risk of possible complications. So it is very important for us to remember that consent is basically giving the physician or the surgeon an opportunity to touch the body of the patient with permission. So let us now have the elements of consent. Of course, in order for us to easily remember the core concepts of the elements of consent, we have to have this mnemonic. It consists of the 5 letters, and of course, it is the word bottom. That's letter V, O, T, U, M. Again, letter V, O, T, U, M. Let's begin with letter V. Letter V is voluntary. So when I say voluntary, it means that's free of coercion. There's freedom. So it means that the consent is going to be signed by our patient with no use of force. So therefore, in order to answer the question that I posed a while ago, what about the bioethical principle that is being applied, especially when the consent is being taken from our patient, and that's going to be autonomy. The bioethical principle of autonomy. See, autonomy, that's going to be self-determination or independence in which the patient can actually decide on his or her own. So that's letter V, voluntary. Letter O, opportunities to ask questions. So of course, it is a responsibility of us nurses to make sure that the patient is actually well informed, that they can actually ask questions with the physician or the surgeon or even to the nurse, especially with regards to the procedure, because it is also their right to ask questions. So that's letter O, opportunities to ask questions. Let's now have letter T. Letter T is treatment are explained. So as much as possible, it is our responsibility to make sure that the treatment are basically explained to the patient and also to the significant others. And to answer the questions that was actually posed a while ago, who is responsible in teaching the patient or explaining the procedure to the patient? Answer, it has to be the physician or the surgeon. What is then the role of the nurse in the health teaching? Of course, our role is to reinforce the knowledge of our patient with regards to the procedure. So again, letter T is treatment are explained. Letter U, understood by our patient. Of course, it is very important for us to remember that we have to evaluate if the patient understood or understood the topics that we have mentioned with regards to the procedure. It is our responsibility to make sure that we are going to validate the knowledge of our patient. That's letter U, understood by our patient. Letter M, mature physically and mentally. When you talk about mature physically, it means that this patient is actually 18 years old and above, so of legal age. And at the same time, mentally, it means that there's no mental incapacity that will actually hinder the patient in signing the consent. So that is basically the 5 elements of the consent. Letter V, voluntary. Letter O, opportunities to ask question. Letter T, treatment or explained. Letter U, understood by patient. And of course, letter M, letter M is mentally and physically mature, or mature physically and mentally. So it's very important that these elements are actually present. Let's now go with the parameters of consent. So we've mentioned a while ago that the surgeon are basically responsible in teaching the patient with regards to the procedure. So it is our responsibility to reinforce. And what will be included in the teaching? So we will be having this element or parameters of our health teaching. So let's have the 4 parameters of consent. Of course, in your teaching, you have to include there the word CRAP. Let's there C-R-A-P. C-R-A-P, that's CRAP. Letter C is complications. Of course, you're going to include there in your teaching about the complications of the procedures that the patient is going to undergo. Letter R is risks. Of course, risk would actually be very important for you to include also, because of course the patient has the right to know what are the possible risks that will actually going to be possibly the risk that could be under parang pwedeng mangyari that will actually going to possibly happen to the patient, especially when the procedure is being performed. Then letter A is alternatives. Of course, we're going to make sure that the patient knows the possible alternatives other than the possible invasive procedure. And of course, letter P are basically the prognosis. So it is very important for us to have this aspect, especially on the parameters of the consent. So we have done already with the elements and also the parameters of the consent. So now, let's take into consideration who are those individuals who can sign the consent, especially if the patient is not capable of signing the consent. And of course, we have the mnemonics LPG. LPG, that's letter L, letter P, and of course letter G. Let's begin with letter L. Letter L is legal guardian. Of course, this legal guardian is basically those individuals who actually have been taking care, who are actually delivering care to the patient, of course, in behalf of the parent. Of course, they can actually sign the consent in behalf of the patient, especially if the patient is not capable of signing the consent on or by himself or by herself. The second one is, of course, the parent. So this parent is basically responsible in signing the consent, especially if the patient is actually minor. So that is, or minor or mentally incapacitated to sign the consent. So that's letter P. And of course, letter G is guardian ad litem. So this answers the third question that was posed a while ago, talking about who can sign the consent in behalf of the patient, especially if that is in state of emergency. And that's gonna be letter G, guardian ad litem. So guardian ad litem are basically physicians or surgeons who can actually sign the consent in behalf of the patients because that is in state of emergency. So they can sign because, of course, what matter is basically the life of the patient. So that answers our third question that was posed a while ago. So that is basically the 3 individuals who can sign the consent in behalf of the patient, especially if the patient cannot actually sign the consent on his own or on her own. So let's remember the elements of consent. Bottom, voluntary, opportunities to ask questions, treatment are explained, understood by patient, and mature physically and mentally. The parameters of consent, the word CRAP. Letter C is complications, letter R, risk, letter A, alternatives, and of course letter P, prognosis. And of course, who can sign the consent in behalf of the patient if the patient is not capable of signing the consent? The mnemonic is LPG, legal guardian, parent, and of course the guardian ad litem. But before we'll end this vlog, of course, it is also very important for us to take into consideration this consideration, especially if the patient is minor, but the patient is actually living outside of the family. They have their source of income, they build their own family already, and that's going to be under the emancipation doctrine. So emancipation doctrine is giving this individual the opportunity to sign the consent by himself or by herself, especially because they are considered to be separated from their family. And also to answer the questions with regards to who is responsible in securing the consent, and that has to be the physician or the surgeon, because they are responsible in explaining the procedures, therefore they are also responsible in securing the consent or letting the patient sign the consent after explaining the procedure. And also to answer the questions regarding what is the role of the nurse, especially in securing the consent, and the answer is we served as a watcher, because during the signing of the consent we are going to serve as our patient advocate, because as a watcher we are going to uphold the rights of our patient, especially in the performance of the procedure. So just remember, in order for us to remember the answers of the 5 questions, the first question is what bioethical principle is being applied when the consent is being secured? Answer: autonomy or self-determination or independence. The second question is who is responsible in securing the consent from our patient? And the answer is physician or surgeon. The third question is what is the role of the nurse in securing the consent from our patient? The answer is witness or patient advocate. The fourth question is what or who can sign the consent in behalf of the patient if that is in state of emergency? Answer: physician or surgeon, because of the doctrine guardian ad litem. The fifth question is who is responsible in explaining the procedure to the patient? Answer: it has to be the physician. Just have to remember, bottom crop LPG, it's all about the consent. Okay? So if you're actually new to this channel, please don't forget to subscribe our channel, and also please don't forget to click the notification bell para ma-update naman kayo sa mga possible future uploads natin sa board exam essentials. And also if you like this video, please don't forget to hit the like button, and also if you want this video to be known by others, share this video to them. And also if you want something to talk about, comment down below. This has been Nurse Jose at your service to make your best even better.